payer goes to a project that involved collaboration with physicians around the world to drive evidence-based care delivery and improve outcomes and generate medical assistance and evacuation cost savings plans for participants who were living abroad. This initiative, as its outcome, showed that there were 27% reduction in days in hospitals and reduced the cost of need for medical evacuations by 5%. Overall, that helped generate a 35% savings in global medical spend costs and 24% savings in international medical evacuation costs. I think it's important to recognize this is a milestone for the Doyle Award and for MCG. It represents the expansion of the health effectiveness programs around the world and of MCG's use, because it's the first award that goes to a global healthcare project. Accepting this award is UnitedHealthcare Global, which received the award, and Seal Foster, Dr. Tracy McLuhan, Deirdre Rowan, and Dr. Margaret Wilson.
It's really with incredible pleasure, and it's a great honor, that we accept the Richard L. Doyle Award on behalf of UnitedHealthcare Global. Thank you very much. Credit goes to Tracy McLuhan, Seal Foster, Deirdre Rowan, an incredible group of leaders with UnitedHealthcare Global that represent all our global teams. This is the team that put a face to what we do globally, be it the baby from Ivory Coast who was critically ill and needed to be evacuated in the dead of night all the way to Paris, be it the executive with a myocardial infarction who needed life support and we needed to maintain care in place, be it one of our own, a United Health Group executive who was involved in a near-fatal crash in an unfamiliar country. This is the team that does all that, and credit goes to them. And as we worked our way through these cases, we rapidly recognized that the historical global healthcare model was completely broken. We had to move away from a transactional model to a transformational model. We had to come away from managing people out there only when they needed acute care, more towards what Greg Dorn described so eloquently yesterday as the arc of healthcare, focusing on quality agnostic of technological platforms. Now, we couldn't do this alone. I guess this is the point at which I pull out that long list and take up the next 2 hours thanking everyone, but I won't do that. But I must give credit to the enterprise. Several of our colleagues across the enterprise worked with us, our US-based domestic teams, our colleagues from Optum, our colleagues from UnitedHealthcare Brazil, our colleagues in the UK, our clinical care delivery, and our colleagues all the way in Manila, Optum Global Solutions, all came together to make this possible. However, we absolutely would have made no progress without an incredible partner. Credit goes to MCG for having the courage and the bravery to step out there with us into an unknown terrain. Brazilian physicians continue to speak about Bill Rifkin and the most important evidence-based decision Bill had to make in Brazil, and that was to wear a tie or not to wear a tie. But in honesty, the reason why this worked is because an incredible organization like MCG came together with UnitedHealthcare Global. We share values. Our values align around performance, innovation, around integrity, relationship, and most importantly, around compassion. because this brings me to the end. None of this, all of this would be meaningless if we take our eye off the ball. And for us, the ball is the patient, the individual out there. In the global world, I say to my team all the time, it's that person with a suitcase in the middle of the airport, going out there, business, leisure, expat, to make the world a brighter place. And therefore, it is with extreme humility that we accept this award on their behalf. Thank you so much.